Hey, Dr. Amy here. Neuropathy in your fingers and your toes after chemo can be painful and frustrating. The good news is that there's ways to reverse the symptoms and be free of the neuropathy. Here are 10 ways to treat and reverse the neuropathy after chemo. Starting with number 1, gentle stretching. Gentle stretching is known to relieve tension and take pressure off the nerve, therefore decreasing peripheral neuropathy. I want to show you some very simple but specific exercises that you can do even while watching TV or sitting at your desk. That's coming up next. But we first need to understand why neuropathy is happening. Neuropathy is typically described as a tingling, numbness, sensitivity to cold or heat, but most commonly described as pins and needles. But it can also be more than that. Peripheral neuropathy can cause weakness in your hands and in your feet. Maybe you're now having a tough time grasping objects or opening jars. It can also cause imbalance, which puts you at risk of falling. Definitely not good. Of course, the best thing you can do about peripheral neuropathy is prevent it from happening in the first place. That's why you see a lot of people wearing iced gloves or iced socks during chemotherapy. This actually decreases blood flow to the extremities and prevents peripheral neuropathy. Now, if you already have the damage and you already have peripheral neuropathy, you're in the right place. This is exactly what we're going to be getting into here. A breast cancer survivor that I work with really struggled with neuropathy after her chemo treatment. She loved to be outdoors and walk her dog. But since the neuropathy in her feet was actually quite severe, she had found herself falling quite a few times while walking her dog. Her balance was off and she was really struggling. She was actually scared to take her dog for a walk now. As a breast cancer survivor, she received chemotherapy that actually causes peripheral neuropathy. There are many chemotherapy drugs that do this: docetaxel, carboplatin, vincristine. The good news is that symptoms are generally reversible, which is exactly what we found with this breast cancer survivor. We use these exact strategies found in this video to get her back to herself and pain-free. Back to walking her dog and enjoying the outdoors. We started with gentle stretching. Now, when you have peripheral neuropathy, you might tend to avoid movement or exercise because it hurts. But a lack of movement can actually worsen neuropathy. Here are 2 simple stretches you can start today. If you have neuropathy in your feet, sit on the ground and place a towel around your foot. Flex your foot and gently pull. If you have neuropathy in your hands, you can try a similar stretch. You won't require a towel for this stretch, but you can gently pull your hand in different directions. Start with these simple stretches right now. Even while you're watching this video, you can start. The next thing you can do to be free of neuropathy is to focus on stress reduction. Start including breathing exercises, meditation, yoga in your daily routine. Relaxation strategies have been shown to lessen neuropathy and reduce the pain. It's such a simple and proven strategy to reduce the neuropathy that you're experiencing, but hardly anyone's using it. The third way to lessen your neuropathy is massage. Massage is useful in stimulating the nerve and helping with relaxation. Start really simple. You absolutely don't need a professional, but the option is there. What you do want to do is make sure that you're doing this on a regular basis. Massage your feet, hands, or both for 10 minutes twice a day. You can use lotion or coconut oil. It's going to decrease the pain, improve stimulation, and help lower your neuropathy. Another option for simple massage is to roll your feet or your hands over a tennis ball or lacrosse ball. This gentle movement over a ball will work to help massage your feet and hands. Now, massage actually leads me to the next way you can lessen neuropathy: desensitization. Massage is definitely a type of very gentle stimulation, but now we want to take it one step further. Exposing your hands and feet to a variety of textures will help with neuropathy. Start by filling a container with dried rice or dried beans. Then place your hands or your feet in that container. Move them around and allow the nerve to be stimulated. This is essentially training the nervous system. Next, you want to add objects to that container, like coins or marbles or game pieces. Then move your hands around and try to grasp the objects. A transcutaneous nerve stimulation or TENS machine will accomplish a very similar thing. These machines use small currents of electricity to stimulate your nerves. It will treat pain and improve functioning. They're often available for you to purchase on your own, or if you want to try it out, you can go to your physiotherapist and they will often have one there. Now, here is a great way to desensitize your feet. Walk on the beach. If you're going on a hot vacation or live somewhere close to the beach, this is a really good option for you. The sand offers stimulation of your nerves, but also requires balance to walk on the uneven surface. So you'll be working on both desensitization and your mobility. That leads me to point number 5, balance exercises. If your balance has been impacted by neuropathy, then you must focus on training your balance to feel confident and comfortable in your body after cancer. Here are some simple exercises to work on improving your balance. Keep in mind that people who do consistently complete these exercises over time do improve their balance. This will work. Start with your feet together side by side, looking forward. If you're able to hold your balance doing this, then try slowly looking around the room while keeping your feet together. Next, let's move on to something more challenging. Walking forward, I want you to step toe to heel. If you're able to keep your balance doing this, then again, I want you to slowly look around the room while walking forward toe to heel. Next, you can try sidestepping and then backward stepping, then try marching. If at any time you feel unsteady, simply hold onto a wall, to the back of a chair, or someone else's hand to give you support. Beyond these movements, we also want to include some exercise movements. I know when I was recovering from chemo, I definitely found it difficult to exercise. You are exhausted, achy joints and muscles, and now you have this neuropathy. It's terrible. This is why I'm going to suggest these very strategic but very simple exercises to manage your neuropathy. Some people do find that walking or running is too painful when you have neuropathy. So here are some options that are better suited. Biking and swimming are good alternatives. They offer low impact exercise, and if you're using a stationary bike, then you don't have to worry about stability. If you do happen to get pain during exercise, then you'll want to break up your intervals into smaller chunks. For example, instead of completing 30 minutes of exercise every day, break it up into 3 10-minute sections. This will allow you to have a break in between. Let's move on to number 7 though, because we haven't reviewed any alternative health options, and there are actually quite a few that are backed by good scientific evidence. This last one is gonna surprise you. Acupuncture has shown good evidence to lower the pain due to neuropathy. A 2016 systematic review found that acupuncture is actually a good option for neuropathy relief. This strategy has shown to be effective in diabetic patients who experience neuropathy in a very similar way. It's best to find a practitioner in your area that specializes in neuropathy or in working with people with cancer. There's also some encouraging literature that supplements can improve neuropathy. Before we get into supplements, let's take a quick look at prescription medications and over-the-counter medications that might be useful for neuropathy. In terms of prescription drugs, drugs like gabapentin or pregabalin are often used for managing nerve pain. However, some people do report that these medications make them very sedated or turn them into a zombie. Not ideal. But the truth is that these medications are tough to tolerate, and they do take weeks before they actually work. Now, what you might find helpful is a topical cream that contains a counter irritant. These are creams that include ingredients like menthol or oil of evergreen or camphor. They're found in products like Rub A535. They're going to stimulate the skin and actually trick the nerve to focus on something other than the actual nerve pain. Obviously not a long-term solution, but something that could offer you relief in the short term. Okay, but now on to the supplements that are useful for treating neuropathy. Vitamin B is commonly used to treat neuropathy. Vitamin B6 has been shown to be useful in people with diabetes that experience neuropathy. And vitamin B12 has been shown to maintain nerve tissue, which again can be quite helpful here. Studies have looked at vitamin B6, 50 milligrams 3 times a day, and vitamin B12 injected every 3 weeks. However, it is important to note that mega doses, high doses of vitamin B can actually cause neuropathy. You want to make sure to avoid these high doses, these mega doses, and consult your team to make sure your dose is right for you. Some people also find relief with alpha-lipoic acid. This supplement fights free radicals that can cause molecule damage. Therefore, it can give relief to that tingling or pain you might be feeling. The last supplement that you should know about is L-glutamine. This has many benefits in people with cancer. It's not entirely known why it's useful in peripheral neuropathy, but it is thought to have a neuroprotective effect. Okay, but this next strategy may make you laugh a little bit, but it has been shown to be helpful. Whole body vibration. This always reminds me of those workout machines from back in the day, but they're much more sophisticated now. Whole body vibration can be helpful for neuropathy, but also for lymphedema, because it's actually moving the body and therefore moving your lymphatic system around. But if you're struggling with neuropathy from chemotherapy, then you must check out this next video. This is just as important as everything we've reviewed here. So let's dive in. I'll see you in the next video.